The BELLINI trial was a phase 3 trial that was designed to examine the efficacy of Venetoclax, which is a BCL2 inhibitor in patients with relapsed multiple myeloma. Based on the initial preclinical work demonstrating activity of Venetoclax and phase 1 trials demonstrating clinical activity with Venetoclax used alone, in combination with Dexamethasone, or in combination with Bortezomib and Dexamethasone, the BELLINI trial was designed as a randomized phase 3 trial that enrolled patients with 1 to 3 prior lines of therapy who are proteasome inhibitor naive, and these patients were then randomized in a 2:1 fashion to standard dose of Bortezomib dexamethasone with 800 milligrams of Venetoclax given daily, or a placebo. The primary endpoint for the study was progression-free survival. The initial analysis demonstrated almost a doubling of the PFS from 11 months to 22 months with the addition of Venetoclax. However, the initial analysis also demonstrated an increased mortality or increased early deaths amongst the patients who are getting Venetoclax. Now, with approximately 4-year median follow-up, we have updated results again demonstrating that there is a significant improvement in the PFS from almost to 23 months from 11 months with the addition of Venetoclax. Even though there were some early deaths in the initial part of the study, primarily limited to the non-translocation 11-14 patients, we did not see any further increase in deaths in the Venetoclax arm with the longer-term follow-up, and the overall survival curves are starting to come together, and they are no longer statistically significant. Now, one of the interesting observations with the Venetoclax studies has been that it is much more active in translocation 11-14 myeloma and myelomas that has high levels of BCL2 expression. So this updated analysis also focused on the subgroups, and we were able to show that in the translocation 11-14 patients, the 20 patients who got the Venetoclax versus the 15 patients who got the placebo, the PFS was significantly improved with a hazard ratio of 0.12. Now, if you look at the BCL2 high patients, again, we see a significant benefit in the PFS without any adverse effect on the overall survival. So what we have learned from this updated analysis is if you have either translocation 11-14, or if you have a high BCL2 expression by quantitative PCR, which is respectively about 15% of myeloma patients and 40% of myeloma patients, your outcomes are improved with the addition of Venetoclax in terms of the progression-free survival without any change in the overall, any adverse impact on the overall survival. The follow-up continues on the study, but I think the data from here clearly demonstrates the ongoing development of this molecule in the translocation 11-14 patients, and exploration for a BCL2 high, a biomarker that will assess the BCL2 expression for the remaining patients.